Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Fragile X syndrome. The Fragile X syndrome is a genetic disorder. This is the second most common cause of mental retardation after Down syndrome. Fragile X syndrome is a trinucleotide repeat disorder. Repetition of the CGG. Normal repetition is 6 to 55 in a healthy individual. Pre-mutation repetition is 55 to 200. Full mutation is greater than 230. The defective gene is the familial mental retardation 1, also called FRAXA. The locus is on the X chromosome, long arm, there is the XQ23.7. The protein produced by this gene is present to everyone, FMR1, and the FMR1 protein is produced, that is the called FMR1 protein, familial mental retardation 1 protein. So if there is repetition more than 200 or like greater than 230, then the gene will be off. This gene will not work, and protein FMR1 protein will not form. So brain cells, specifically the synapses of the neurons, the junction between two neurons, will be permanently modified, and people develop mental retardation due to lack of this protein, due to inability to function of this gene, that will lead to mental retardation. Okay, so we got that feature. It is an X-linked disorder, although female is also affected, but they have less clinical symptoms than that of the male. We got two siblings. 8-year-old mentally deficient boy has a relatively normal appearance, long face, prominent ear, and his testes usually very large, in 90% cases, large testicles. Okay, will get high arched palate. Okay, there may be hearing and visual problem on rare occasion. There may be some heart problem. There may be hyperextensibility of the joints. The arch of the foot may be flattened. Okay, so that may happen. And there will be behavioral problem. There will be learning disabilities. Okay, learning disability, similar features with a long face, prominent ear. It's his sister. Notice strabismus, crossed right eye, although it is an X-linked disorder. Female carriers sometimes express the disease like her. Usually male is affected, female may also be affected, although this is an X-linked disorder. Frequency 1 in 1550 males and 1 in 8,000 females. Features in affected male: this is an X-linked disease, mental retardation. So X-linked disease usually is transmitted to the male only, but in case of Fragile X syndrome, a certain percentage of female also manifest the signs symptoms. Mental retardation with low IQ 20 to 60, learning disabilities, mood swings, sometimes they behave funny, sometimes they may shout. Autism, attention deficit disorder, and anxiety disorder. They have a lot of anxiety and lot of frustration also. Long face, large everted ear, large mandible. This is very important. Large testicle, bilateral. Large testicle is present around 90 to 95% of the patient with Fragile X syndrome. The male patients of Fragile X syndrome. Hyperextensible joint seems to be some type of connective tissue disorder. High arched palate, pes planus, that is the arch of the foot will be flattened. If you study the pedigree of Fragile X syndrome, you'll get multiple pattern. Carrier male, around 20 to 30% of male, are clinically and cytogenetically normal. They transmit the trait to their phenotypically normal daughters. Then to the grandchildren. They are normal transmitting males. Affected females, 30 to 50% of carrier female are mentally retarded. Risk of phenotyping effect. Brothers of transmitting male have a 9% possibility of mental retardation. Grandson have 40% chance of mental retardation. What is anticipation? Clinical features of Fragile X syndrome worsen with each successive generation. That is called anticipation. Okay, so if we study the chromosome, suppose from the blood cell, if we put the chromosome in a low folic acid media, we'll get this type of feature. This is the long head of the chromosome, and we'll get here seems to be discontinuity of the staining like this. So this is the sign of Fragile X syndrome. Okay, here is the discontinuity. Fragile X syndrome appears to be discontinuous. If we study the pedigree, okay, we'll get carrier male, normal female. Male can only transmit the defective gene to his daughter. Like here is the daughter, carrier female, carrier female. The sons are not getting the disease. Sons are getting X chromosome from their mother. So this is the carrier female is related to, this is her husband or her partner. So from there, this is normal person. This is the carrier female. What will happen? Carrier female will transmit the X chromosome to her son, to her daughter. Okay, and half of her son, half of her daughter, and here there will be full mutation, X chromosome, and phenotype will be very much affected, totally affected. Here in female, 50% female is affected, often mildly. Clinical manifestation is mild in female, and these two, the girl and boy, they will escape. Okay. Okay, what happens in Fragile X syndrome? If we go there, FMRP selectively binds to messenger RNA in 4% of brain cell. There is the familial mental retardation protein that is coming from the familial mental retardation 1 gene. Okay, this is the protein bind to messenger RNA in 4% of brain cell. Is a translator regulator and suppressor of the protein synthesis at the synapses in association with the glutamate receptor. Glutamate is a neurotransmitter. Okay, so here is the FMRP There is the FMRP here. If we go there again, okay, this is the FMRP, and it will bind with the messenger RNA. Here is the messenger RNA FMRP complex, okay, and this is going there, and there will be axonal protein. That protein will be regulated. This production is regulated by the FMRP, okay, is a translator regulator and suppressor of protein synthesis. And the synapses, this is a synapse, okay, this is synapse, this is axon, another neuron is here connected. So at the synapses in association with glutamate receptor, reduction of FMRP result in increased translation of the bound messenger RNA. Permanent changes in the synapses occur, and there will be mental retardation. Okay, so synapse will be modified. Synapse is the junction between two neurons. So another variety of CGG pre-mutation in FMR1 gene can cause a disease phenotypically different from Fragile X syndrome through a mechanism called toxic gain of function. What is that? Approximately 20% of female with pre-mutation carrier female undergo ovarian failure, and they have premature menopause before the age of 40. Again, approximately 50% of pre-mutation carrying males transmitting males display neurodegenerative syndrome in their 6th decade, characterized by intention tremor, cerebellar ataxia, okay, person cannot walk smoothly, and Parkinson's disease. Again, there will be rigidity, tremor, and involuntary movement, okay, Parkinson's disease. These are happen in 50% of pre-mutation carrying male in their 6th decade. And that's all about the Fragile X syndrome and one of its variety. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice and wonderful day. Bye now.